it is your job as a superintendent, right, to graduate kids college, life, career ready. And so to do that, you've got to get kids in a place where they can attend school, perform well academically.
Produced by Podcast Architects.
Welcome back to another episode of The Path Forward. We're here at TASA Midwinter 2024, Evolve to Solve. I'm joined by my co-host, although he will steal the show, Dr. Carnelius Gilder, West Sabine ISD Superintendent, and also Tracy Spinner, Account Executive, Daybreak Health. Welcome to the show.
Thanks for having. This
Welcome.
is exciting. I love the energy.
Well, this you just put him in a room and you will be electrified. I'll just say it like that.
And I've never co-hosted a podcast, so
Well, this is your first.
yes, so welcome. We're glad to have you here with us today.
It'll be me co-hosting him.
I was going to
promise
say
you.
you've lost your podcast.
Oh yeah,
but
that's
this is
always
now.
the danger of bringing him on because he steals the show, and then I'm just sitting over here like, well, at least I'll get some.
Don't
life.
listen to that.
Well, you could take a break if you want.
Exactly. No,
Don't
I'm
listen
not.
to that.
I want to listen because I want to hear some of the things that you're doing. So, Evolve to Solve. You're in the hot seat.
I like it.
You bravely volunteered for this. So, tell us a little bit about what you do at Daybreak Health.
Well, thank you. Well, first, thank you for having me. I think it's important when we're talking and engaging with superintendents and district leaders to, increase the awareness about, who is out there working in the education space and
Sure.
partnering. So at Daybreak, we partner with school districts all over the U.S. I'm here in Texas, and so Texas is my home. And we partner to provide culturally responsive mental health services, K through 12, really fitting those parts and pieces together to close the gaps in mental health care for students
Okay.
and also for staff and for families. And so we're not just focusing on that kind of tier 3 of clinical, but also providing those tier 1 and tier 2 services.
Doc, I'm kicking it to you. Fire away.
So one of the things that I thought of immediately when I found out who would be here, what attitude or what tone do you get from districts? Are you sensing a state of emergency type of situation? Just thinking, over the course of 2023, let's just target that time.
Yeah, thank you for that question. It's a great question because what I hear from districts when I'm talking to districts all over Texas, from rural to urban, is I hear this sense of urgency that we're at the place now where we have been focusing really for the past couple of years, but focusing on, in 2023, we're now really starting to see those true impacts of the pandemic, not just on the mental health, social, emotional side, but on the attendance, academic, discipline, those risk-taking behaviors. And so when I'm talking to districts, I'm really listening and learning from them and hearing a little bit of that desperation of, we've tried some things and we haven't exactly found, what works yet. And what can we as Daybreak, bring to the table? How can we show that we can really truly help impacts, districts, not only their students' mental and emotional health and well-being, but also what impact does that have on those important academic indicators like attendance, academic performance, at risk, discipline, et cetera. Because at the end of the day, it is your job as a superintendent, right, to graduate kids college, life, career ready. And so to do that, you've got to get kids in a place where they can attend school, perform well academically.
I have to ask this question because not all of my friends and colleagues are as resourceful as Dr. Gilder here. And West Sabine, it's not right around the corner. So for districts that may be rural or don't have access to big cities that have a lot of options, how do you serve small rural districts?
Yeah, I love that question because one of the things that did come out of the pandemic is a more global adoption of telehealth.
Okay.
And so our ability as a company, as a private company, to provide access via virtual care on the computer, on a smartphone that says, hey, you can meet with your therapist Monday through the weekend, 8 a.m., 8 p.m. All you need to do is have a webcam available or a smartphone. that we can serve you, whether you're in West Sabine, whether you're in, Fort Worth, wherever you are, as
Sure.
long as we can connect with you, then we're able to serve you and meet your needs.
Doc?
So, really, when we talk about these types of services, size wise, as far as your company, I mean, you're dealing with students across the country. In the event that I have multiple students, how flexible, what does your scheduling look like when it comes to the kids' need? So, for instance, me as a superintendent, my goal is for my kids to be in all of their instructional classes, bell to bell. What are innovative scheduling strategies that you all use for students?
Like that.
Yeah, I love that question because our goal is your goal, right? Because we want to maintain that integrity of that learning environment and that learning time. And so because we do operate virtually, we are able to offer those before school, after school, even weekend availability for our clinicians to serve, their students. And because we match students, we go through this, individualized matching program to make sure that we're matching for schedule needs, flexibility, culture, ethnicity, diversity, language, even, that we're able to match them to the right therapist to, again, make sure that they're in class. But oftentimes, and you know this, you see the same kiddo coming out every day. You're like, man, something's going on. And if they're not participating in the learning environment because they can't focus, their brain isn't ready for that active listening and learning because they've got something else going on. Sometimes it's best to offer, hey, let's get you with your therapist right now, even though it's 2:00 and you're supposed to be in algebra.
Yeah, yeah,
But because we want you ready to learn and being
definitely.
able to identify, hey, what's going on? Let's make sure we're dealing with that first so that you can be ready to learn and engaged in your class.
Thank you.
Would we have access? So, as a former high school principal and superintendent, you understand that rarely do things happen when it's convenient for everybody, right? So, it's 7:30 at night. You're doing a wellness check on a student. There's been some trauma at the household. They need services immediately, perhaps, and maybe it's not, to the level of 911, but you know that there's trauma. How would you guys go about that if I needed some help immediately, unexpectedly?
Yeah, that's a great question. So while we're not a crisis response provider,
Sure.
the student has access to their therapist. And so what they would do is they could message their therapist if it's, within that 8 to 8, hour that our therapists are on, and say, hey, I'm really struggling. Something's happened. I'm triggered. What we do, because of the influence of AI, is we're able to go on to our platform and identify what is the nearest resource. The parent caregiver is there. We can get them connected, and then we're doing that warm handoff to make sure that the child is safe.
I know you have a piece of legislation that you helped design. Am I accurate on that?
Yes.
What is the sense that you get from some of the folks you've worked with? Do they understand what's going on in schools? Is there a sense of we really need to work towards this, or is it still kind of left to school districts to figure it out as we go?
Rick, it's super interesting. I mean, there's a reason that there's an I in independent in Texas, right? Every school district is an independent school district.
Right.
And as I talk to school districts, I hear a couple of different things that they recognize that there is this importance to focus on student emotional and mental health, but also they have to make sure that students are attending school, that they're performing well academically, all of those things that they're graded upon. And so it's really this delicate balancing act of we recognize that focusing on mental health is important. And at the end of the day, it's seeing what are the results of that. As a district, as a superintendent, as a board, if we're investing dollars into resources,
Right.
is it truly meeting the needs of students that we're
Right.
seeing these good outcomes and indicators?
I mean, are we still struggling to quantify, if we're having this is a direct impact on this, and we know it anecdotally, but do we need to do a better job of quantifying the correlation, if you will?
Yeah, absolutely.
Okay.
Yeah, absolutely. I mean, I think we do a good job of correlating. I mean, we know, you can
Sure.
say, when students are more, healthier,
Sure.
mentally well, you can see, them attending school more frequently, engaged in the learning, engaged in extracurriculars, all of those things. So you can see. And so for us, it's our responsibility to work with school districts to prove that utilization and to prove that ROI.
I got you. Because
Yeah.
we all got 7 bosses, right?
That's right.
You gotta account for, this is why I need this, and here's the result of
That's right.
that need, because it's the community's money. Speaking of money, you got anything you want to know about cost, price,
Well, actually, I have a two-part because I had a little bit of a follow-up.
follow it?
In that, while we were in the green room earlier, we were
Did I miss the green room?
Y'all were over there.
so when we were talking earlier, we were talking about particularly our state and their relationship or their attitude toward mental health. And I know that you are now working in some spaces to represent the authorities. And so, is there any what type of feedback from the state level are they requiring any type of feedback per the decisions that have been made, or it's just in regard to them providing to the 5.5 million students in this state? I just want to know, how are we gauging this any type of way?
Yeah, so thank you for that question. And it's an important question, that fiscal responsibility question. And I'm gonna put on my TEA House Bill 906 task force
Yes.
hat to answer this question, because I think it's important that superintendents, leaders are aware that there is a task force that was legislatively mandated
Okay.
to really look at this issue exactly. It's how are we being fiscally responsible with the dollars that have been allocated from the state to the LEAs? How are they using those dollars to impact student mental health?
Okay.
And so it's holding districts accountable. You have, there's grant funds, there's local funds, there's school safety allotment dollars, there's money that's been allocated. How are you using those dollars to really impact your student mental health, if that's something that your district is, seeing increases in? And then, are we as a state allocating enough resources to the right areas to be able to really get at the issue of student mental
So
health?
it's kind of a twofold evaluation, if you will.
Absolutely.
So
Right.
what should we be doing, or should not be doing or what should we be doing or should we not be doing with those dollars?
I don't think there's a right or wrong answer.
Okay.
I think it really truly depends on the community and the student population in which you're serving. But I will say, what you shouldn't be doing is just throwing dollars out and hoping that resources are going to come and that it's going to solve problems for students. I think for district leaders, it's getting more intentional
Okay.
in those partnerships, in the resources that you're looking for, that you're acquiring, that you're providing, and moving away from casting this broad net and hoping that it's going to hit the students that need it, and just truly getting more intentional.
Yes.
And I've got $20,000 or I've got $5,000. What can I do to impact student mental health with the dollars that I have that are going to give that good return on my investment in terms of student, performance, student mental health and well-being?
So when we were talking about, we were prepared to make the transition to the investment. A lot of the conversations that I've been involved with this week alone have been just school level. We have your super urban districts, you have your mid-sized districts, but then you have a majority of rural, small districts where we already know that, the effects of poor mental health or mental health that's not attended to. But in some of these small districts and counties and cities, that instance, if it goes too far, will cripple the whole community.
Yeah.
To a point that it takes decades to recover. How are we as a state able to advocate for those small districts to be able to come to you investment wise? Is it affordable?
Yeah. So, couple questions I heard. So, one, I think the role of the education service centers
Yes.
is vitally important. So, the ESCs knowing what resources are available in their communities, whether they're public resources, private resources. So, I think one, leveraging the ESC to
Yes.
make sure that they're, reaching out and saying, hey, these are the needs that we have in my community. On the second question around, like, what is the investment, right? What are
Yes.
the dollars to invest?
That's it.
One of the things that I really value about the public-private partnership for healthcare, and healthcare funding is probably equally as complicated as EDU funding, if not more so, is we have the ability as a private company to leverage other payer sources, such as insurance, right? So when you think about Blue Cross Blue Shield, Aetna, any of these other like Medicaid plans, we as a private company have the ability to bill and collect for mental health services to offset the district investment. So really I'm saying, help us, we can help you, and we're going to leverage dollars, but I'm only asking you to pay a percentage of that versus 100% of that.
Yes.
Right?
And
Because
that
I can
makes
leverage
sense
those
because
dollars.
I was trying to eloquently state, do you take Medicaid?
Did I read your mind?
Yeah. You answered that question because when I say rural, when I say small, I mean poverty, poor,
Yeah.
poor communities.
And it's important because for Daybreak, that is part of our mission, is to ensure equitable access to care for all students, regardless of your payer, regardless if you're uninsured, regardless if you're in rural Texas, urban. Our goal is to serve all students because it takes just one. It's one student, and every student has a story. And I was actually meeting with a rural district last week and gonna partner with them. 20 kids in their entire district, K through 12, and the closest resources they have are over an hour away. And
That's the story for a lot of our rural districts.
A lot of us.
Yeah.
And it's important. It's important for the community and the students to know and to feel that they matter, and that they're worthy of these resources. That it's not just for a big district or that community or that town. That they're worthy of that. And so that is one of the beautiful things about our mission. Partnering with education is that we can be anywhere.
What is the best implementation that you have seen or are privy to, right? Because a lot of it's not only, hey, we want to make the investment, but it's also how are we implementing, how are we scheduling, and everybody's got a different scenario of how they go about that. Is there one district or one implementation you seem like this has really worked well for kids?
When I look at like the best practices and implementation, and kind of an example it's when we get buy-in and excitement from different in all levels in the organization, from the superintendent, from the school counselor, if the district has a school counselor, from parents and community. It's really when you get that buy-in and that excitement, because let's face it, we all know this. Mental health still has a significant stigma, especially in Black and brown communities. They don't talk about mental health. It's not something that is talked about. We don't talk about Uncle Frank. We're just going to let Uncle Frank be him, and we're not going to talk about that, right? And so when you've got buy-in and a superintendent like yourself saying, I support this. This is good for kids. This is good for our community. This is how we're going to roll this out, and we're going to do this thoughtfully, and we're going to do this strategically and in a partnership. Because for me, I don't want to be seen as just a vendor. I want to be seen as an extension of your school district. I'm representing you, you're representing me in a partnership together to, at the end of the day, we have the same goal, right? We want your students to be mentally healthy and well, and also perform well academically and attend school.
Exactly. I think that many of us have the same mantra of safe, healthy, and whole. And over the years, I'm glad that we are placing attention on mental health because really it's one of the foundational principles. So one of the things that I was thinking about while you asked that question, when you partner with a district, as advocates, is there a way, or do you all leave your thumbprint? So, for instance, I know that my community knows that I'm serving our students. Are there pamphlets? Are there flyers? Is there something I put on my website? Do we send home mailers? What does that look like?
Yes, all the above. I love a good marketing campaign. So
I do
absolutely.
too. That's why I was
Right?
asking.
Love a good marketing campaign. Yes, so we do. So we work with the district and we provide flyers, multilingual, so whatever languages, are important to you and your community. So flyers, email, scripts, social media, graphics and posts. We can even give you some school messenger scripts if you use school messenger to communicate. And it's also like whatever communication that you typically use.
Yes.
If you have a newsletter or if you have a podcast that you use for your community, it's really whatever you use. We want to be able to integrate into that with you as a partner to help, again, support what you're choosing to do as the leader of your school district. We
Yes.
want to give you all the resources to empower you.
Well, and the reason why I ask that is because, it's my job to provide. I don't have to know that you took advantage of it, but I have to make sure that it's there. And how many times have, even with like the anonymous tip lines or anything like that, they take advantage of that.
Yeah.
But even if only one does, they know that they have that avenue. And so, thank you.
Yeah.
So you said you're a partner, right? And so, some of my colleagues are, demanding in what their partners need to do. So if I am in a district, I call you and said, hey, I need help delivering this to my community, right? And sometimes it's better if it comes, they get tired of hearing me. Help me deliver the message. Tracy, will you come to my district and partner with me and have a couple of community sessions and any questions that folks may have, help me answer those questions? If I make that call,
Absolutely.
yes?
Yeah, and if it's not me, because I
No,
don't,
I said,
I don't
I
look
want
like
you.
want me, I'm there.
I want you, or
I'm
I
there.
want you to. If I say,
Yeah,
hey,
I'm there.
you did this great. I need you to be there.
Yes.
Because superintendents are like that.
Yeah.
You develop trust with someone, right? And
Mm-hmm.
you need to make sure that it's done right. And I want that person who I feel like is going to do the best job for my community, right?
Absolutely. I love to, yes, I would come to any district in Texas who says, Tracy, can you come stand beside me and support me and advocate, for
Sure.
the mental health of our students? I would say absolutely. But I also want to be respectful of your community.
Of course.
And if I don't look like your community, then I'm going to bring somebody else with me
That's
to
right.
answer those questions,
absolutely.
right? Because I want to be respectful of the community in which you serve.
You were the
I'm-
example because
That's right.
when if I'm trusting someone, I usually am going to go to that person within
Right.
the organization that no, I need you because I need to make sure it's done right because there's a
That's right.
relationship there, right?
Absolutely.
But that makes perfect sense. You obviously want to make sure that it's representative of your
Right.
community.
Absolutely. That's important. It's important when you're building trust with an external partner because mental health is so intrinsic and it's something that's so personal. And if it's something that for generations that you've not talked about or discussed, but right, in your family that you've struggled with mental illness and you are concerned that your child may also be
Sure.
going down this pathway, you want to know that you have access to clinicians,
Yeah.
therapists who look like you, sound like you, who've lived your experience. And so that is something, that at Daybreak that we pride ourselves in doing is that custom matching because it's important and it does matter. And it does matter when it comes to, therapeutic alliance
Mhm.
and students going through their full treatment, right? Their full therapy.
100%.
Yeah.
100%. Doc, you got anything else?
So I just wanted to know about. So we know that this is completely private and that this is their session. This is their. What is the role of your company when it comes to communicating with the school? As an example, a group of kids over here or see something or know something that is impending, and I have a whole group of 7th grade girls that start to call to make, and so your company now has information that my administrators don't. In times like that, is there communication back to that point of contact, i.e. the counselor? How does that work?
Yeah, that's a great question. And it's mental health and working within schools is so dynamic, and that's going to happen, right? So there's a couple ways that we communicate with school districts. First, the therapist who is working, with the student has that relationship with also the school counselor or whomever referred the
Yes.
student. So the district has a dashboard that is password protected. It's all the necessary protections in place, right? And so you've got, number one, access there to share bi-directional information with us, number one. Number two, if our therapist receives information, from a student that could indicate that there might be something pending, we have to share and communicate that information.
Mm-hmm.
And so we're going to communicate that back with our district contact person, whether it's the counselor, assistant principal, whomever that is. We have to communicate that back, and we do. I mean, legally, we have to communicate that. So that is the benefit of having the partnership, as well as, we're making sure that we're getting the necessary, FERPA, HIPAA consents to that we're sharing information appropriately back and forth. But at the end of the day, when it comes down to school safety, and if there is some indication that there is some concern about school safety, we're going to absolutely share the information.
Yeah, because I know that, anytime anybody signs up with a counselor, I mean, I live with one.
So
Uh-huh. But as districts, we have a see something, say something. But then also we are held liable for instances such as bullying and stuff like that. So if something doesn't cross that line, but, I'm really just trying to, whatever way we can, create a bridge to make sure that we are, meeting those needs.
We're accountable for certain things, and we want the professionals helping us to understand our accountability in that. And there's got to be careful on how we circumvent those things and keep privacy intact. But we got to know because we're accountable.
That's right.
Yeah. And because we are a private company and we're coming in for just this slice of time, we don't know how big is big and how bad is bad. And
That's
so
right.
We're always going to err on the side of caution
to
be able to share, information that we're aware of, because there may be other things that we're not aware of through your behavioral threat assessment process, as an example, where you are, monitoring or you're keeping eyes on students who may be, going down a pathway that you want to make sure that you're intervening sooner.
Mm-hmm.
And so we want to make sure that we're sharing that information timely and appropriately.
All right. Thank you. That answers my question.
Excellent. Well, I want to thank, number one, my co-host, Dr. Gilder.
It was great.
Maybe we need to find you how's that superintendent job doing? You all right over there? You want to come?
Well,
I'm joking. West Sabine. I'm just playing.
Texas weather.
Thank you for being my co-host, and Tracy, thank you for being on the hot seat. You did a great job, fantastic job for as you well know, a delicate subject, right, and one that's affecting all schools everywhere.
Well, when you're passionate about it, it's an easy conversation to have.
Absolutely.
And it's complex, but I appreciate the opportunity, and thank you so much for the amazing questions.
Oh, no, thank you.
You can put me in the hot seat any day. That was awesome.
Well, before we go, share out how do we get in contact with you if school districts are interested?
Yeah, so you can reach out to me directly, Tracy Spinner at daybreakhealth.com, or visit our website, daybreakhealth.com, or find me on LinkedIn or social media, Tracy Spinner.
Awesome, outstanding. And to our audience, if you like what you heard or you saw, please like and share and leave some comments for Dr. Gilder, right? Tell him how good a job he did.
Absolutely.
Oh, thank you. That was sweet. Thank you for the opportunity. It
Always.
was great. This was
Very
excellent.
nice to meet you.
Thank y'all.
Produced by Podcast Architects.